Hi everyone, I'm Dr. Aniruddha Bhuiyan. I'm a vascular and endovascular surgeon, and I'll be talking to you about vascular and endovascular surgery. What is vascular disease? It is in our aging population. Vascular disease is a common cause of disability and mortality, and vascular disease or diseases of the blood vessel can be characterized into arterial, that is the blood carried from the heart into the other parts of the body, as venous, where the blood comes back into the heart, or lymphatics. In terms of diseases of the arteries, most of the diseases of the arteries are because of atherosclerosis or calcification or plaque formation or fat deposition of the blood vessel. And one can experience the symptoms of intermittent claudication, in which one gets muscle cramps on walking or pain or walking. Can be manifested with gangrene, with stroke, with kidney or other multi-organ failures, with aneurysms where there is an abnormal dilatation of the blood vessel supplying any part of the body, which may lead to rupture and death if not treated on time. In terms of diseases affecting the vein, it can be including varicose veins, which are dilated and engorged veins in the leg, which can lead to pain, discoloration, and ulcers if they are not treated, and they do not heal very easily. They can also be deep venous thrombosis, that is blockage of the veins which lead to the heart, and these blockages are because of the clots, and these clots can break up and go into the lungs, which can cause pulmonary embolism, leading to life-threatening conditions. Now let me talk to you about what is vascular and endovascular surgery. Now, it is a field of medicine which deals with the diagnosis, the treatment, and the prevention of arteries, veins, and lymphatic disorder. And there are more and more people affected with these vascular diseases. But the good news is that there are varying number of treatments, modalities, and diagnostics for such problems, which is increasing in today's India. Vascular and endovascular surgery is now a specialized field in which a vascular surgeon can perform both open and endovascular procedures for his or her surgeries, and thus treat the patient. Let me talk to you about what are some of the special investigations which a vascular surgeon can use. They include non-invasive investigation like ultrasound, which are arterial, that is the arteries, and the veins, which is the venous duplex examination. It can also be ABI, which is called ankle brachial index. It can also be angiograms, which are CT, MR, or radioisotope. There are multiple invasive investigations which are also used, which are conventional angiographies, which are X-rays of the blood vessel, which are taken because of injection of contrast media into the blood vessel. It can also be carbon dioxide angiography, in which carbon dioxide gas is taken and injected into the blood vessel to visualize. These modalities are used in renal failure patients. In terms of how are the vascular diseases treated, it can be managed with general treatment on advice of lifestyle, in which a patient who is smoking should be advised not to, with dietary modifications, with lifestyle changes of reducing the risk factors like high cholesterols, diabetes, etc. Medications, there are multiple blood thinners which are available to prevent or treat arterial blockages. There are various treatments which reduce the venous leakage for venous disorders, and there are various treatments for reducing the lymphatic leakage for the lymphatic disorders. In terms of surgery, vascular diseases deals with basically all types of surgeries except the heart and the brain. So these can be done by open procedures, which are surgical, and endovascular procedures, which involves minimally invasive techniques. Now, the open surgical reconstructions include the bypasses, in which the patient's own vein or artificial grafts are used for repair. It can be direct repair, including endarterectomy or removing of the plaque or the fat from the blood vessel. It can be AV access procedures with AV fistulas or grafts, which are used by dialysis patients, and they act as a lifeline for dialysis for such patients. There can be varicose vein surgeries, which include radiofrequency ablation, glue ablation, laser ablation, as well as sclerotherapy. Now, the endovascular procedures include angioplasty and stenting, in which a wire is placed into the blocked blood vessel, a balloon is placed over the wire, angioplastied or ballooned up, and then a stent may or may not be placed to reinforce the vessel. In terms of endoluminal stent grafting, in which this stent which is used has a fabric over it, and this fabric can be used to contain the blood leakage in terms of aneurysms or in terms of dissections of the blood vessel. There can also be catheter directed thrombolysis, in which it involves an injection of drugs to dissolve the clot in the affected part. There can be insertion of devices like coils, vena cava filters for multiple modalities of vascular issues. Other forms of treatment also include having a foot clinic, having a structured exercise program for claudicants, compression bandages for venous insufficiencies, as well as physical therapy for lymphedema. Now, when do you need to consult a vascular surgeon? You need to meet a vascular surgeon if you have, number one, upper limb or lower limb swelling, if you have an upper limb or lower limb pain, if you have ulcer on your leg or your hand, when there are diabetic foot infection, when there are dilated veins or varicose veins in your leg, when you have a deep vein thrombosis, when you have an AV fistula or an AV graft, when there is gangrene, when there is a coldness of the leg, when there are diminished hair or nail growth, when there is claudication or rest pain, when there is discoloration, when there is hyperpigmentation of the skin, when there are AV malformations, when there is a coldness of your hand in terms of Raynaud's phenomenon, when there are weakness of the extremities, when there is a TIA or a stroke or syncope or sudden blindness, please meet your vascular surgeon. Thank you very much.